CFS, chronic fatigue syndrome. Chronic fatigue syndrome, CFS, is a disorder characterized by extreme fatigue or tiredness that doesn't go away with rest and can't be explained by an underlying medical condition. CFS can also be referred to as myalgic encephalomyelitis, ME, or systemic exertion intolerance disease, SIDE. Here's what you need to know about CFS, including symptoms, treatment options, and outlook. What causes CFS? The cause of CFS is unknown. Researchers speculate that contributing factors may include viruses, a weakened immune system, stress, hormonal imbalances. It's also possible that some people are genetically predisposed to develop CFS. Though CFS can sometimes develop after a viral infection, no single type of infection has been found to cause CFS. Some viral infections that have been studied in relation to CFS include those caused by Epstein-Barr virus, EBV, human herpes virus 6, Ross River virus, RRV, rubella virus. People with CFS sometimes have weakened immune systems, but doctors don't know whether this is enough to cause the disorder. Some people with CFS may concomitantly have some deficiencies in vitamins including B2, riboflavin, or B12, but it is unclear if they improve with vitamin supplementation. What are the symptoms of CFS? Symptoms of CFS vary based on the individual and the severity of the condition. The most common symptom is fatigue that's severe enough to interfere with your daily activities. For CFS to be diagnosed, a significantly reduced ability to perform your usual daily activities with fatigue must last for at least 6 months. It must not be curable with bed rest. CFS can also introduce sleep problems, such as feeling unrefreshed after a night's sleep, chronic insomnia, other sleep disorders. In addition, you may also experience loss of memory, reduced concentration, orthostatic intolerance. Going from lying or seated to standing positions makes you lightheaded, dizzy, or faint. Physical symptoms of CFS may include muscle pain, frequent headaches, multi-joint pain without redness or swelling, frequent sore throat, tender and swollen lymph nodes in your neck and armpits. CFS affects some people in cycles, with periods of feeling worse and then better. Symptoms may sometimes even disappear completely, which is referred to as remission. However, it's still possible for symptoms to return later, which is referred to as a relapse. This cycle of remission and relapse can make it difficult to manage your symptoms, but it's possible. How is CFS diagnosed? CFS is a very challenging condition to diagnose. According to the Institute of Medicine, as of 2015, CFS occurs in about 836,000 to 2.5 million Americans. It's estimated, however, that 84 to 91% have yet to receive a diagnosis. There are no medical tests to screen for CFS. Its symptoms are similar to many other conditions. Many people with CFS don't look sick, so doctors may not recognize that they indeed have a health condition. In order to receive a CFS diagnosis, your doctor will rule out other potential causes and review your medical history with you. They'll confirm that you at least have the core symptoms previously mentioned. They'll also ask about the duration and severity of your unexplained fatigue. Ruling out other potential causes of your fatigue is a key part of the diagnosis process. Some conditions with symptoms that resemble those of CFS include mononucleosis, Lyme disease, multiple sclerosis, lupus, SLE, hypothyroidism, fibromyalgia, major depressive disorder, severe obesity, sleep disorders. The side effects of certain drugs, such as antihistamines and alcohol, can mimic symptoms of CFS as well. Because of the similarities between symptoms of CFS and many other conditions, it's important to not self-diagnose. Talk to your doctor about your symptoms. They can work with you to get relief. How is CFS treated? There's currently no specific cure for CFS. Each person has different symptoms and therefore may require different types of treatment to manage the disorder and relieve their symptoms. As mentioned above, some people with CFS may also have functional vitamin deficiencies and theoretically may feel better with vitamin supplementation, but much more study is needed. Work with your team of healthcare providers to create the best treatment plan for you. They can go over the possible benefits and side effects of the therapies with you. Addressing post-exertional malaise (PEM) symptoms. PEM occurs when even minor physical, mental, or emotional exertion results in CFS symptoms becoming worse. Worsening symptoms usually occur 12 to 48 hours trusted source after the activity and last for days or even weeks. Activity management, also called pacing, can help balance rest and activity to avoid PEM flare-ups. You'll need to find your individual limits for mental and physical activities, plan these activities, and then rest to stay within these limits. Some doctors refer to staying within these limits as the energy envelope. Keeping a diary of your activities may help you find your personal limits. It's important to note that while vigorous aerobic exercise is good for most chronic conditions, people with CFS don't tolerate such exercise routines. Home remedies and lifestyle changes. Making some lifestyle changes may help reduce your symptoms. Limiting or eliminating your caffeine intake can help you sleep better and ease your insomnia. You should limit or avoid nicotine and alcohol too. Try to avoid napping during the day if it's hurting your ability to sleep at night. Create a sleep routine. Go to bed at the same time every night and aim to wake up around the same time every day. Medications. Typically, no one medication can treat all of your symptoms. Also, your symptoms may change over time, so your medications may have to as well. In many cases, CFS can trigger or be a symptom of depression. You may need low-dose antidepressant therapy or a referral to a mental health provider. If lifestyle changes don't give you a restful night's sleep, your doctor may suggest a sleep aid. Pain-reducing medication can also help you cope with aches and joint pain caused by CFS. If medication therapy is needed, it will have to be tailored for your needs. Work closely with your doctor. There's no one-size-fits-all treatment for CFS. At the end, it is requested you to please subscribe our channel.